It really took the 20th century and what was learned about the relationship between environment and disease for primary care to really evolve into an effective vehicle for prevention. But I think if Dr. Emerson were here, he could probably list a number of things that he recommended for his patients. And some of them were probably things like fresh air and a long walk, which we would agree today are really good for your health. He certainly wasn't recommending that people do strenuous exercise. Strenuous exercise wasn't thought to be good because the people who exercise strenuously, the guys at the shipyard or people who were manual laborers, didn't happen to live very long. Our understanding of exactly how to prevent disease really exploded in the 20th century, and it continues to develop today. So I think that the doctors of that era were in good faith doing the best they could to prevent disease. They weren't able to treat a lot, and a lot of the treatments that they had were not effective. The lifespan in 1922 of the average American was 47 years. Lifespan now is closer to 87 years. So we almost have doubled the life expectancy. I'm sure people born today probably have a life expectancy over 87. Most of that gain has been from the development of antibiotics in public health. It has not been from the diffusion of hospitals. Hospitals are preventing catastrophe. So, if you get hit by a bus, you're a lot more likely to live today than you were in 1922. But you're a lot more likely to have reached the age of getting hit by a bus because you were immunized as a child and had antibiotics for your strep throat when you were a child and were able to survive to the modern time. The hospital as a public health entity is an area which only became a focus of hospitals in the 60s and 70s and really until more recent than that. I think that's an area where the hospital is working hard. I think there's a lot more that we can do in the future to be a source of general public health for the region that we serve.